So in terms of preserving security, we all start from right at the point where the data is trying to come in through SFTP. There's only a put coming in, and from there, trying to read from blob storage like S3 or ADLS, parsing large volumes of data, getting into the database. And from then on, how are these data engineers and integrators working with our system? We have Citrix-based VDI access, where you have really strict policies on there to say that you cannot download, screenshot, copy paste. So very stringent rules. By the way, we are HIPAA, HITRUST, SOC 2 Type 2 certified, and we've already started on FedRAMP and GDPR and other certifications. And as part of that entire data processing pipeline, it becomes really important that the different personas in the pipeline need to access different types of data to drive those analytical outcomes. Some may need some parts of the data, some parts of the entire, columns of patient data, and they may not be aware of how they are querying. So how do you ensure you're not inadvertently exposing any PHI or PII to these, so that we are HIPAA compliant, HITRUST compliant in all of these. So it's really important to have the right tools. As Faizan mentioned, the data masking and data governance, role-based access at each of the layers, and as they get transformed. And we've also built a custom ACL engine on top of all of these databases that map to the organizational hierarchy of the healthcare industry. And that's what makes our healthcare data platform that's so specialized for this market, that you can easily take that hierarchy and put ACL structures in place to say at what level, as you go higher up in the structure, you get broader level access, but you could still limit. And that's where these kind of data masking, data auditing tools are extremely important.